Hello everyone, my name is Nkurunungi. I'm a service user using services of mental health, and this has been ongoing since early mid 90s, around 97, when I first got my episode with mental illness. It was a very challenging time, very difficult, and puzzling in a way that I didn't know, and my family didn't know what to do. But hopefully they sought for help, and I was brought to Butabika Hospital, where I was put in a side room. My coming to hospital was uncertain because I was given a jab which sedated me, so I gained consciousness when I was in the side room. That is the four walls in which people are put for seclusion as a way of offering them support when they are disturbed. And that was very disturbing for me because I didn't know how I got there, and I was seeking for help. There's no window. The easiest way to access it is reaching for the ceiling and trying to look out through the small ventilation for help to get out. And eventually I came out of the side room, but I was disturbed and kept asking many questions: why I was here, what I was doing here, what I was being subjected to, why I needed to be here. It was a roller coaster, if I may say, because I didn't know what was happening to me, and I was so agitated and restless, and my mind was disorientated. But eventually I found my way out of hospital. Although I was not formally discharged, I was seeking to get in touch with my colleagues at college where I had come from with the onset of the illness. I eventually got to college and somehow got support from my colleagues and staff, and they took me home to my parents in the suburb of Kampala, in a place called Mashinje. So I continued treatment from home, and eventually the symptoms healed. There was one staff who was very supportive by the name of Mike Mutabingwa. He was a PCO. He kept coming to visit me at home and giving me treatment, which was supplied by Butabika Hospital. Eventually, I felt better and thought I should go back to school to continue my studies. So after that, I went back to school, continued, and completed in 99. And shortly after that, my mother passed away due to a motor accident. She had been very supportive to me. She would come to hospital to check on me and give me support, and very, very, very supportive. And I had a close relationship with my mother, having been her only son. So when she passed away, I felt a very big void, and a very big vacuum was created in my life. And I thought I should find a way of how to maybe join my siblings in the diaspora, and eventually I traveled to the UK with the hope of finding a better life. When I got to the UK, there was a culture crash, and expectations were dashed because it was difficult to find formal jobs, and I ended up doing menu jobs, which stressed me because it was at the back of my mind that this is not what I'm placed to do, but I had to do it because I had to get ends meet. And it strained on me. Within a period of about 2 weeks, I broke down and found myself in hospital. When I got to hospital, they asked me, had you ever been treated for mental illness? I said, yes. Where about? I told them Butabika. I said, where is that? I said, it's a hospital in Uganda. So they treated me, but my levels of insight were very low, and I was in denial. So I told them I wanted to go back to my country, I wanted to live out. They discharged me more or less after a period of about 2 weeks. I don't know whether that was premature, but close to the end of my treatment, a lot had been done in Butabika. It had been refurbished, World Bank, DFID, that put in money to develop and what. So they told me the treatment you're receiving here, you can actually receive it in your country. Would you like to go back or you want to stay? And so eventually our plans were put in place for me to come back, and I came back in August 2007 to Uganda. Reaching here, there was an aftershock because so much had happened. Things had gone off. My friends that I used to live with most had got married. They started families. So there was another vacuum created of starting a new network of friends. I stayed with minimal interaction, but eventually somehow the people in the UK, we had a group called the Working Together Group Meeting, where we would meet with clinicians to see how we could improve services. They would hear our voice, we people were receiving services, and how we felt we should be treated. And along the way, links had been formed with Uganda, in particular Butabika, because around 2004, 2005, trusts were turning into foundations, and it was a requirement for these trusts to have service user voice on the board. One of the boxes to tick, like service user voice, develop a partnership with the developing country and all that. So because of the history of my coming from Butabika, having been in Butabika, they thought it would be a good link to link up with Butabika and follow up the history, because psychiatry is basically based on following history of somebody and know what is happening. So they thought it would be befitting to forge a link with Butabika and East London. And that link had been formed. Exchange had been happening. Actually, some clinicians who had treated me when I was first in Butabika had been able to visit me when I was in hospital, and were able to dialogue in our native language, which was very welcoming at the time. So links had been formed, and they put in place a way of transitioning me to come back. And when I came back, the link had grown, but they felt they should have a service user component of the link. And that is when people like Mr. Sadiq Hall, who was a very big champion of service user involvement, came up with an idea of fronting the Heartsounds venture in Uganda. He came in 2007 during the Chogam time to present it, and the one of the people who wanted to get in touch with me was myself, and he came up with this idea. We made plans. He thought of, he spread it around, and the following year in 2008, he came with a group of 8 people from East London that included staff and service users to promote the Heartsounds venture. So eventually, they met up with a number of people. They made a tour in Uganda. They went to Ginger, had radio talk show. They made a very glamorous event at the hospital, where one of the prominent service users in the names of Joseph Atkunda gave an address, and they thought of how to start it. Now, they brought the spark, and people here were the fire. One of the people was Joseph Atkunda, who became very passionate about it, to promote it and all that. So we teamed up with Joseph. He called a number of us. We thought of what, but we didn't know what to do, because it was something new to us. We're just picking our brains, and we didn't know how to register. We said an NGO that was reaching for heaven. But eventually we thought of starting a CBO, which was, because CBO you just need 20 people, and you register, you get a constitution, and you have a committee and a board. So we registered the organization as a CBO in 2010, and we started running. Now when we started the Heartsounds, that is when I really developed my network of friends, because I met people, like they say, birds of the same feather flock together. You know, people I could relate to, people who would appreciate me the way I am, people who would not stigmatize me or isolate me or look at me as some weirdo, but people would appreciate me for something. So we started working together, and I developed this with a lot of enthusiasm. With my finance background, I was very key in writing projects and following them up with the implementation and all that. Right now, I am working at Butabika as the project financial officer on the Brain Gain project, a UK aid funded project that is aimed at spreading peer support on the wards of Butabika and the rest of Uganda, and starting up a recovery college in the hospital grounds of Butabika Hospital, the first of its kind in Africa. So my journey has not been smooth, but I hope that those of you who are listening or viewing are able to relate to me and inspire you with hope that this can be done, because I have been able to bring life to this world in the form of a daughter, and she's ably supported in school, and recently she got a place in one of the best schools in the country in the name of Mount St. Teresa Namagunga Boarding Primary School, where she'll be going next year. I couldn't have achieved this if I was not taking my medication, which has enabled me to function and do get to sustain a job that can pay school fees for my daughter, which has enabled her to do the interviews and pass them to join a reputable school like Namagunga Boarding Primary School. So I urge those of you, my fellow service users, to stick to your regime of medication and be compliant and live a healthy life that can enable you to function and contribute to society like any other person in the community. I hope this message will be useful to you and inspire you, especially those who are challenged with mental illness, to live a fruitful life and support yourself and be empowered to empower yourselves and others, and live to fruition of your life with a legacy to leave behind.